The distinction between the consultancy room and the experience room allows for a more granular and controlled approach. Discussion before experiential work, co-creative work around what might be on the other side of the door, incrementally walking to the door, opening the door, looking through the doorway, and returning to the couch in the consultancy room as needed. This can be actual tracked movement or through the use of a controller while stationary. Within the experience room itself are options for loading a variety of different objects and immersive scenes, and several ways of interacting with them. This interaction can be virtual, using handheld motion trackers or the keyboard and mouse of a computer. Or, with a mixed reality installation, virtual assets can be layered upon physical props that are motion tracked. Users of the platform are visually represented in the space by a simple avatar, which can be further developed if needed. In terms of user roles, the architect curates a database of content that is generally appropriate, as informed by the clinic's policies and client profiles. The operator, with specific reference to any indications or contraindications clarified during the intake process, loads relevant assets into the space under the guide's direction. At this point, these resources are only visible for the guide, who can then further adjust their features before introducing them to the participant. The participant can then in turn adjust their properties, and constraints can be set to ensure objects vary only along dimensions that are consistent with the therapeutic aims of the scenario. Interaction takes place through creating objects and clearing them, locomotion through the space so users can stand in different positions in relation to the elements, the ability to move objects, and the ability to scale them. Objects can be colored in ways that are significant for their meaning. They can be used as a canvas so they can be drawn upon, allowing for even more detailed refinement. They can have a mirror texture, which can reflect the participant's avatar and the rest of the scene. Objects can also have a screen texture, allowing for media files to be played upon their surface. For greater photorealism, individual 3D items can also be placed in the space. In addition to these objects, immersive scenes can be loaded that transform the experience room into a location. Relevant objects can then be positioned within that scene, facilitating more context-sensitive interaction. Just as a blank spreadsheet doesn't prescribe how calculations should be carried out, but offers a flexible space to support data processing, in the same way the mixed reality therapy room offers scaffolding for the therapeutic process, but a great deal of range in terms of how that is carried out. For the sake of demonstration, it is helpful to consider 3 approximate categories of therapeutic work: work with aversive, addictive, and supportive stimuli. In practice, a number of stimuli may be utilized and combined in a flexible way in keeping with therapeutic protocols and participant need. Frequently, within virtual reality therapy and other therapies that have a simulated component, the workflow progresses from imaginal work, where topics are explored and mentally visualized, through to virtual work, through to real-world practice. There may be multiple loops of this sequence, as any challenges are brought back into the therapeutic process and further explored and worked through.